Welcome back to part 2 of Clinical Anatomy of the Foot and Ankle for Athletic Training. In this portion, we're going to focus on the soft tissues, the arteries and veins, and the neurological innervations of the lower leg, foot, and ankle. We're going to go ahead and start with muscles of the lower leg. We see 3 different views here, and we're going to start with the view on the left, the first posterior view. The first muscle that we're going to identify is the gastroc, or gastrocnemius. The gastrocnemius actually has 2 heads. It has the medial and lateral head of the gastroc. Working distally, we see the soleus and the plantaris. The gastroc, the soleus, and the plantaris all work to form the Achilles tendon. If we were to strip these muscles away, we would then see the popliteus, the tibialis posterior, the flexor digitorum longus, the flexor hallucis longus, and once again that Achilles tendon. Now for the lateral view, we have the peroneus longus, peroneus brevis, the attachment for the peroneus brevis on the base of the 5th metatarsal, the superior peroneal retinaculum, and the inferior peroneal retinaculum. These retinaculums we need to be aware of because they can also be injured with a lateral ankle sprain. And finally, the extensor retinaculum. If we were to cut the lower leg at a transverse angle, we would actually find 4 compartments. The first being the superficial posterior compartment, made up of the soleus, plantaris, and gastrocnemius. Next, we have the deep posterior compartment, made up of the tibialis posterior, flexor digitorum longus, peroneal vessels, flexor hallucis longus, tibial nerve, and posterior tibial vessels. As you see, it also shares a border with the fibula and the tibia. The third compartment is the anterior compartment, made up of the interosseous membrane. And as we spoke in the previous lecture, this interosseous membrane runs between the tibia and the fibula. We have the tibialis anterior, the deep peroneal nerve and anterior tibial vessels, the extensor hallucis longus, and extensor digitorum longus. And finally, we have the lateral compartment, made up of the superficial peroneal nerve, peroneus longus, and peroneus brevis. Here we see 2 different views of the tendons of the foot and ankle. We've already identified the Achilles tendon, so we're going to move past that. We're going to start with the medial view. There are 3 specific tendons that we really need to be aware of, and I'll give you an easy way to remember these. The most anterior of these is the tibialis posterior. Next, we have the flexor digitorum longus, and finally, the most posterior, the flexor hallucis longus. T, B, and H. We refer to these as Tom, Dick, and Harry. If we move more distally, we now see the tibialis anterior. Moving to the dorsal view, we have the extensor digitorum longus, the peroneus brevis, the peroneus longus, both on the lateral aspect of the ankle. We have the extensor hallucis brevis, extensor hallucis longus, and finally the extensor digitorum brevis. Make sure to remember Tom, Dick, and Harry, the tibialis posterior, flexor digitorum longus, and flexor hallucis longus. Moving from a dorsal to a plantar view of the foot, we see the plantar fascia. Working more proximally, we now have the flexor digitorum brevis, the abductor digiti minimi, the abductor hallucis, and finally the lumbrical muscles. These are accessory tendons of the flexor digitorum longus. As I spoke in the lecture before, there are 2 sesamoid bones in the foot. The first being the medial sesamoid, and the second being the lateral sesamoid. In between these two sesamoid bones, we find the intersesamoid ligament. Working from counterclockwise to clockwise, we will see the deep transverse metatarsal ligament, transverse head of the adductor hallucis, oblique head of the adductor hallucis, lateral head of the flexor hallucis brevis, medial head of the flexor hallucis brevis, abductor hallucis, and finally the joint capsule. Moving from the muscles to now the arteries and veins, we're going to start most proximal and work distally. The first artery and vein we see are the femoral vein and femoral artery. Continuing on, we have the deep femoral artery, the great saphenous vein, the popliteal or popliteal artery, posterior tibial artery, anterior tibial artery, and finally the arcuate artery. Now looking specifically at the foot and ankle, the first thing we see on the dorsal surface is the dorsal pedis artery. This is where we actually take a dorsal pedal pulse. Moving further distally, we have the lateral tarsal artery, followed by the dorsal metatarsal and digital arteries. And now moving to the plantar surface of the foot, working from proximal to distal, we have the medial plantar artery, and finally the lateral plantar artery. Make sure to remember where to find that dorsal pedis artery, because that's where we take the dorsal pedal pulse. Finally, we come to the neurological innervation of the lower leg, foot, and ankle. And looking at a posterior view of the lower leg, the first nerve that we're going to look at is the common peroneal nerve. This you'll see in orange. Next, we have the tibial nerve in pink, the sural nerve in blue, the medial plantar nerve in red, and the lateral plantar nerve in purple. As you can see, we have a little bit better view of the foot here, so you can see the posterior tibial nerve and see how it actually breaks off and branches to become that medial plantar nerve and the lateral plantar nerve. The posterior tibial nerve actually runs parallel with the posterior tibial artery and vein and goes directly behind the medial malleoli. And looking at another view of the lower leg, we have once again the common peroneal nerve, which branches to become the deep peroneal nerve. The other branch is now the superficial peroneal nerve. The superficial peroneal nerve now branches 2 more times to serve the peroneus longus and peroneus brevis. Finally, as we go even further distally to the ankle and foot, there's a branch of the lateral cutaneous and medial cutaneous branch of the nerves to the foot. Here we can see specific innervation areas of the nerves that we just covered. The first being the deep peroneal nerve, which innervates the anterior compartment. Next we have the superficial peroneal nerve, which innervates the lateral compartment. Then the sural nerve, which innervates the posterior and lateral leg and lateral foot. And finally, the saphenous nerve, which innervates the skin on the medial ankle and foot. Rather than tell you the nerve innervation, action, origin, insertion for every muscle of the lower leg and foot, I provided additional slides that you can view at your own convenience to learn each one of these. As we stated before, you have had anatomy and physiology, so overall this is just a big review for you.